Well, June is Men's Health Month, and today we're learning about some critical medical issues in men and some new technology and how it can help fix them. Joining us today is Dr. Michael Albrecht, Director of Northeast Baptist Hospital Robotics Center of Excellence. Good afternoon.
Good afternoon.
So as a board-certified general surgeon, what type of men's health concerns are you able to help your patients address?
Well, thanks for having me on today. The most common thing I'd like to talk about is what we see most commonly in men are hernias. About 1 million surgeries for hernias are performed every year in the United States. And of the most common, 90% of those occur in men. In fact, 3% of men will experience a hernia sometime during their lifetime. That may not seem like a lot, but with conditions that require surgery to fix, that's quite a high incidence. In fact, it's probably the most common operation we do as general surgeons here.
So hernias are pretty common in men. Tell us exactly what they are, what causes them, and the main treatments for them.
Well, a hernia in general is a weakness or a hole in the muscle of the abdominal wall. And if there's an abnormal protrusion, either of tissue or an organ, that comes through that hole or weakness. They can start off very small as a lump and be very asymptomatic. Or they can progress, especially during physical activity or exertion, but a simple cough or sneeze can cause it to become stuck and very painful, and sometimes that becomes an emergency situation. As we're emerging from the pandemic, relative inactive state that most of us were in, we're starting to return to physical work, we're starting to return to physical exercise, and that's why we're seeing more frequency of hernias happening. Treatments include, really, this is one of those conditions where there's really no good non-surgical alternative. A hernia is a mechanical defect in the abdominal wall, so it requires a mechanical repair, and that's done through surgery.
And there's lots of new tech to help them out. So what can they expect from the hernia repair surgery?
There are several different ways of fixing hernias. The traditional, what we call open repair, has been around for a very long time. More recently, we know that laparoscopic repair of hernias is overall a better repair. It's safer. There's less chance of recurrence, less chance of infection, and it seems that patients get back to their normal activity and work a lot sooner. Even more recently, at the Robotics Center of Excellence at Northeast Baptist, my group is very proficient in repairing these robotically, which is a laparoscopic technique using the Da Vinci robot. We noticed that there's actually even less pain. In fact, many patients require no pain medicine after the surgery. The biggest challenge in doing it robotically, to be honest, is keeping patients from doing too much too soon. There's still a restricted period where we don't want you to overexert yourself in the healing process, but most patients feel like they can do a lot more, a lot sooner than we really want them to.
Fantastic information. And for more information and to find a doctor, visit the website on your screen or call 866-309-2873.